If you're a man over 40, what I'm about to tell you might be uncomfortable at first, but it could completely transform your intimate relationship and give your partner pleasure she's probably never experienced before. And here's the part that might sting a bit. Most men think they know how to perform oral sex on a woman, but based on what women tell me in private consultations, the vast majority of men are doing it completely wrong. I'm Dr. Madison Li, board-certified urologist with over 12 years of experience, and while my specialty is male health, I work closely with couples on sexual function and intimacy. What I'm about to share comes from years of conversations with women who feel safe enough to be honest about what actually works, combined with scientific research on female anatomy and arousal that most men have never learned. Here's the reality. Most men approach oral sex the way they approach their own pleasure: fast, direct, focused on one spot, aiming for quick results. But female anatomy and arousal work completely differently. What feels good to you does not translate to what feels good to her. And if you don't understand this fundamental difference, you'll spend your entire life thinking you're good at something when your partner is just being polite. But here's the good news. Once you understand the actual anatomy, the real arousal patterns, and the specific techniques that create intense pleasure, you can become genuinely skilled at this. And when a woman experiences oral sex done correctly, the response is dramatic. We're talking about levels of arousal and satisfaction that strengthen your entire relationship. Stay until the end because I'm giving you specific anatomical education, exact techniques, common mistakes that kill arousal, and the communication strategies that make this a connected experience instead of a mechanical act. Let me start by telling you why this matters more after 40 than at any other time. As men age, erectile function often becomes less reliable. You might need more time to get aroused. Your refractory period after orgasm gets longer. Your erections might not be as firm as they used to be. This is normal physiology. But here's what this means for your intimate relationship. The sexual dynamics that worked in your 20s and 30s when you could get hard instantly and go multiple rounds don't work the same way anymore. If your entire sexual repertoire depends on penetration, you're setting yourself up for frustration and disconnection as you age. Men who are truly skilled at oral sex never have this problem. Because their partner's pleasure doesn't depend on their erectile function. They can create intense satisfaction regardless of whether they have an erection. This removes performance pressure, which ironically often improves erectile function because you're not anxious about it. I've had countless men over 40 tell me that learning proper oral technique saved their sexual relationship. Their confidence increased. Their partner's satisfaction increased. The pressure to perform with an erection decreased. And paradoxically, their erectile function improved because the anxiety was gone. Now let me give you the anatomical education that most men never received. You cannot be good at this without understanding what you're actually working with. The clitoris is not just the small visible bump you can see. That's only the glans, the tip. The entire clitoral structure is much larger. It has internal legs that extend several inches into the body on either side of the vaginal opening. The entire structure contains approximately 8,000 nerve endings, more than any other part of the human body, male or female. For comparison, the head of the penis has about 4,000 nerve endings. The clitoris has double that concentration. This means it's incredibly sensitive and requires a completely different approach than what feels good on male anatomy. The clitoral glans, the visible part, is covered by a hood, similar to foreskin on an uncircumcised penis. This hood protects the glans because it's so sensitive. Direct, firm pressure on the bare glans is often painful or overwhelming, not pleasurable. This is the first mistake most men make. They think more pressure and more direct contact equals more pleasure. Wrong. The vestibule is the area around the vaginal opening. It's rich with nerve endings and responds to light touch, warmth, and indirect stimulation. The labia, both inner and outer, are sensitive to touch and contribute to overall arousal. The entire vulva, not just the clitoris, is an erogenous zone that deserves attention. Now let me explain female arousal patterns, because this is where men get it most wrong. Male arousal is relatively linear. Stimulation leads to erection, more stimulation leads to increased arousal, continued stimulation leads to orgasm. It's fairly straightforward. Female arousal is cyclical and requires building. It's not linear. Arousal builds, then plateaus, then builds higher, then plateaus again. It requires patience, variety, and reading her responses. Rushing to the end destroys the process. Women need time to become fully aroused. Blood flow to the genital area increases gradually. Natural lubrication develops. The clitoris engorges. The vaginal opening expands. This entire process takes time, often 15 to 20 minutes or more. If you're going straight for intense stimulation before her body is ready, you're fighting against her physiology. Most women cannot orgasm from direct, intense clitoral stimulation alone. They need building arousal, variety and sensation, and often indirect stimulation that teases and builds tension. The goal is not to attack the clitoris. The goal is to create waves of pleasure that build progressively until orgasm becomes inevitable. Now let me give you the actual technique. This is based on what actually works, not what you see in adult films or what you think works. Step 1. Start slowly and indirectly. Do not go straight for the clitoris. Begin by kissing and lightly touching her inner thighs, lower abdomen, hips, and outer labia. Use your breath. Light, warm breathing near her vulva without direct contact creates anticipation. Spend at least 5 minutes on this buildup. You're activating blood flow, building arousal, and creating anticipation. This foundation is critical. Step 2. Begin with broad, soft contact. When you first make contact with your mouth, use a flat, relaxed tongue with broad, soft licks. Not pointed and jabbing. Not hard and fast. Soft, warm, broad contact over the entire vulva. Lick from bottom to top slowly, covering the labia and clitoral hood but not directly on the glands yet. Do this for several minutes. You're warming up the tissue, increasing blood flow, and building arousal gradually. Step 3. Introduce variety. Alternate between different types of contact, broad flat licks, gentle sucking on the labia, light kisses on the mons pubis, and circles around the clitoral hood without direct contact on the glands. The key is variety and unpredictability. Repetitive, robotic motion numbs sensation. Varied, creative movement maintains high arousal. Step 4. Indirect clitoral stimulation. Now you can pay more attention to the clitoral area, but still primarily through the hood, not directly on the glands. Use the flat of your tongue to make slow circles around the clitoris. Use gentle suction through the hood. Press softly with your tongue against the hood, applying indirect pressure to the glands underneath. Watch and listen to her responses. Her body will tell you what's working. Step 5. Introduce rhythm only after high arousal. Once she's clearly highly aroused, breathing heavily, hips moving, muscles tensing, then you can introduce more consistent rhythm. Find a motion and pressure that she responds to and maintain it. Consistency at this stage is what allows orgasm to build. But switching techniques too early or maintaining the same motion for too long before she's ready both destroy arousal. Step 6. Pay attention to the entire structure. Remember that the clitoris has internal legs. You can stimulate these through gentle pressure with your fingers on either side of the vaginal opening while your mouth works the external area. This dual stimulation is incredibly effective. Some women also respond to gentle penetration with 1 or 2 fingers while you continue oral stimulation. Always ask or pay attention to her responses before adding this. Step 7. Maintain rhythm and pressure through orgasm. When she's approaching orgasm, do not change what you're doing. Men often make the mistake of speeding up or increasing pressure at this moment. Wrong. If what you're doing is working, do not change it. Maintain the exact same rhythm and pressure until orgasm completes. After orgasm, the clitoris becomes extremely sensitive. Reduce pressure immediately but don't completely stop contact. Gentle, soft contact as she comes down from orgasm feels good. Abrupt stopping can be jarring. Now let me tell you the common mistakes that destroy the experience. Mistake 1. Going too fast, too soon. You cannot rush female arousal. It takes time. If you're trying to make her orgasm in 5 minutes, you're likely creating discomfort, not pleasure. Mistake 2. Too much direct pressure on the clitoral glands. This is painful for most women, especially before full arousal. Keep contact primarily through the hood or on surrounding areas until she's highly aroused. Mistake 3. Repetitive, robotic motion. Doing the exact same movement for 10 minutes without variation is numbing. Arousal requires variety, unpredictability, and building tension. Mistake 4. Ignoring her responses. If she's pulling away, tensing in a bad way, or showing no signs of arousal, what you're doing isn't working. Pay attention and adjust. Mistake 5. Making it about your ego. This is not a performance where you prove your skill. This is a gift you're giving her. Let go of ego and focus entirely on her pleasure and responses. Mistake 6. Not using your hands. Your mouth should not work alone. Use your hands on her thighs, hips, breasts, or for internal stimulation. The combination is more powerful than oral stimulation alone. Mistake 7. Stopping too soon. Many women need 15, 20, even 30 minutes to reach orgasm through oral sex, especially if they're not used to it or if they have arousal difficulties. Be patient. If your jaw gets tired, take brief breaks and use your fingers while you rest, then return to oral stimulation. Now let me address the communication piece, because technique alone isn't enough. You need to create an environment where she feels comfortable guiding you. Before you begin, tell her, "I want to learn exactly what you like. Guide me. Tell me what feels good." This removes the pressure on both of you. She doesn't have to pretend something works if it doesn't. You don't have to guess. During the experience, pay attention to her nonverbal cues, breathing rate, muscle tension, hip movement, and vocal sounds. These tell you what's working. If you're not sure, you can ask, "Does this feel good? Softer or firmer? Faster or slower?" These simple questions show you care about her pleasure. After the experience, whether or not she had an orgasm, have a brief conversation. What felt best? What should I do more of next time? What should I do differently? This feedback loop makes you progressively better every time. Many men fear asking these questions because they think it makes them seem inexperienced. The opposite is true. Men who ask and learn are the ones who become genuinely skilled. Men who assume they know everything often remain mediocre their entire lives. Now let me give you some advanced tips that take this to the next level. Advanced tip 1. Build anticipation throughout the day. Send her a message in the afternoon telling her what you plan to do to her that evening. Anticipation is a powerful part of female arousal. By the time you actually begin, she's already mentally aroused, which makes physical arousal happen faster. Advanced tip 2. Create the right environment. Dim lights or candles. Comfortable temperature. Clean sheets. No distractions. Women often need the environment to feel right before they can fully relax into pleasure. This isn't frivolous. This is biological. Female arousal requires feeling safe and relaxed. Advanced tip 3. Eliminate the pressure to orgasm. Tell her there's no goal. You just want to pleasure her for as long as she wants. This removes performance anxiety on her end, which paradoxically makes orgasm more likely. Advanced tip 4. Explore different positions. She doesn't have to lie on her back with you between her legs. Try her sitting on your face, which gives her control over angle and pressure. Try side-lying positions. Try incorporating oral sex into other positions. Variety keeps things interesting. Advanced Tip 5. Learn her individual anatomy. Every woman is slightly different. Some have more sensitive clitoral glands. Some respond better to internal stimulation. Some need very light touch, others can handle more pressure. The only way to learn her specific anatomy is through patient exploration and communication. Let me share a story that illustrates why this matters. I had a patient, John, 48 years old. He came to see me about erectile dysfunction. As we talked, it became clear that his ED was causing massive anxiety. He felt like he was failing his wife. Their sex life had become stressful. I asked him about oral sex. He said he'd tried it occasionally but didn't think he was very good at it, and his wife never seemed that into it. I explained that he'd probably been doing it wrong, using male-style direct, fast stimulation instead of the gradual, varied approach women respond to. I gave him information similar to what I'm sharing today. I told him to focus on becoming truly skilled at oral sex, which would take the pressure off his erections and likely improve them as a side effect. 2 months later, he came back for follow-up. He said everything had changed. He'd spent time learning what his wife actually responded to. He'd focused on her pleasure without worrying about his erection. She'd had orgasms through oral sex for the first time in their relationship. The pressure was gone. The intimacy increased. And his erectile function had actually improved because he wasn't anxious anymore. He told me, "I spent 20 years of marriage thinking I knew what I was doing. I was completely wrong. These 2 months have been a revelation for both of us." That's the power of actually learning this skill instead of assuming you already know it. Here's what I want you to understand. Sexual skill is not innate. It's learned. And most men never learned proper technique because nobody taught them. You probably learned from adult films, which are performances designed to look good on camera, not to actually create female pleasure. Or you learned from guessing, which means you likely reinforced incorrect techniques for years. But you can change this starting today. You can become genuinely skilled. You can give your partner pleasure she's never experienced. You can strengthen your intimate connection. You can remove performance anxiety from your sex life. All it requires is humility to admit you might not know everything, willingness to learn, patience to practice, and openness to communication. Here's my challenge to you. Have a conversation with your partner this week. Tell her you want to learn exactly what she likes. Tell her you want to focus entirely on her pleasure with no expectations for reciprocation. Then take your time, use the techniques I've outlined, pay attention to her responses, and ask for feedback. Don't expect perfection the first time. This is a skill that improves with practice. But I guarantee that if you approach this with genuine intention to learn and please her, your intimate relationship will transform. If this video gave you information you wish you'd learned decades ago, hit that like button. Share this with other men who could benefit from actual education instead of guesswork. Subscribe to this channel for honest, science-based information about sexual health and relationships. I talk about topics most doctors avoid. Turn on notifications so you don't miss content that could improve your intimate life. Comment below, keeping it respectful, and tell me, did you learn anything new from this video? And if you're willing to share, has oral sex been a source of confidence or anxiety in your relationships? Remember, this is educational content about human sexuality and anatomy. While the topic is intimate, the information is medical and evidence-based. This doesn't replace personalized advice from healthcare providers who know your specific situation. I'm Dr. Madison Li, and I'll leave you with this. The best lovers are not the ones with the most experience or the biggest anatomy. The best lovers are the ones who care about their partner's pleasure, who communicate openly, who learn continuously, and who approach intimacy with patience and attention. You can be that person. Starting today. See you in the next video.